Welcome to the Willow Creek online training program. Today's module is entitled Reasonable Responses to a General Pandemic. All this information is taken from the CDC website. The purpose of this module is to discuss how to mitigate risks brought on by a pandemic. What's a pandemic? It's a disease that's spread throughout the world. It's very contagious. All of this material was taken from the CDC website, CDC for Centers for Disease Control and Prevention. That's where all the experts are located, and you can get all the latest information there. Your best source of information for COVID-19 will come from the CDC website at www.cdc.gov. So if you have any kind of pandemic going along, this is the website I'd go to get the latest information. Now, I'm not an expert on pandemics, so all I did is I went to the CDC website, cut this out, and I'm just going to be reading through it. But this is what the experts have to say about COVID-19. Now, I just made this a general lecture for pandemics in general. Should others come along, I'm not going to record a different one for every one. But I think most of these are good things to keep in mind during pandemics. They're pretty general. Okay, with that being said, let's get going. How to prepare. Here's what you can do to prepare your family in case of the COVID-19 spreads in your community. First, know where to find local information on COVID-19 and local trends of COVID-19 cases, how quickly it's spreading, etc. To get that, you need to go to your local area. Know the signs and symptoms of COVID-19 and what to do if symptomatic. Okay, you're experiencing symptoms. Okay, and I'm going to talk later about the signs and symptoms, but right now, if you are symptomatic, what do? First of all, stay at home when you are sick. It doesn't spread nearly as quick if everyone that gets sick just stays home and quarantines for a while. Call your healthcare provider's office in advance of a visit. Your healthcare provider is probably very busy, and they need to be organized to effectively and efficiently take care of the needs of their patients. So please call in advance of a visit. Limit movement in the community. There you go. Limit visitors. So you're basically limiting social contact, which will slow down the spread of the disease. Why do we want to do that? So the professionals can learn more and more about this disease before it reaches its peak, so they'll know how to deal with it. By the way, what is a pandemic? A pandemic is a disease that is spread worldwide, an infectious disease. And next, know what additional measures those at high risk are in your home, who are vulnerable, and who you should take care of. And I have a slide on this in just a little bit, so we'll talk about that. Implement steps to prevent illness. We've already talked about this. Stay home, and you're going to see this quite a bit more because it's very important. Stay home when sick. Hand washing, respiratory etiquette. In other words, when you cough, cover your mouth. Clean frequently touched surfaces on a daily basis. Next, create a household plan of action in case of illness in the household or disruption of daily activities due to COVID-19 in the community. For example, in my household, if anyone gets sick, they go downstairs and they're quarantined downstairs, and we seal it off from the rest of the house. And we'll still obviously be able to feed them and everything. But the important thing here is we have a plan. You also should have a plan. A very specific plan. How are you going to feed them and all those types of things without getting everyone else sick? Consider 2-week supply of prescription and over-the-counter medications, food, and other essentials. Know how to get food delivered if possible. You really should try to keep a 2-week supply of prescription, I think, is a general good advice. Because what happens during a pandemic, if you wait till the pandemic arrives, everything's busy, the shelves are being stripped of all the goods. So you're better off if you do this before. This is just good practice before a pandemic takes place. Establish ways to communicate with others, such as family, friends, and coworkers. Establish plans for telework, what to do about child care needs, how to adapt to cancellation of events, etc. Know about emergency operation plans for schools, workplaces of household members, etc. Okay, establish plans for telework. We're right in the middle of this COVID-19 right now, and I do training for a living, and I'll tell you, everyone's that can possibly work from home, telework, they're doing it. And so it's kind of interesting how that works. Fortunately, we're able to do that with technology. All right, watch for symptoms. What are the symptoms? Fever, cough, shortness of breath for this COVID-19 anyway. I'm going to read that. Reported illnesses have ranged from mild symptoms to severe illness and death for confirmed coronavirus disease. Okay. The following symptoms may appear 2 to 14 days after exposure. Okay. So that means you have 2 to 14 days to spread this disease before you even know you have it. So that's kind of part of the scary thing about some of these pandemics. But anyway, for the COVID-19, which we're talking about here lately, while I'm recording this, we're right in the middle of this pandemic, by the way. But again, the following symptoms may appear 2 to 14 days after exposure: fever, cough, shortness of breath. This is based on what has been seen previously as the incubation period for MERS-CoV viruses. So just in past viruses, sometimes we use past viruses to help us prepare for the present one. But the reason they put an asterisk there is it may be a little different. We don't know. That's why you need to stay up to date on these things. Remember, for COVID-19, fever, cough, shortness of breath. If you develop emergency warning signs for COVID-19, get medical attention immediately. Emergency warning signs include difficulty breathing or shortness of breath, persistent pain or pressure in the chest, new confusion or inability to arouse. You're very docile. Bluish lips or face. That's never a good sign. This is not all inclusive, by the way. Please consult your medical provider for any other symptoms that are severe or concerning. And so remember, every pandemic's going to be different, but for the COVID-19, there they are. How to protect yourself. There is currently no vaccine to prevent coronavirus disease, COVID-19. The best way to prevent illness is to avoid being exposed to this virus. This virus is thought to spread mainly from person to person, between people who are in close contact with one another, which means within about 6 feet. Through respiratory droplets produced when an infected person coughs or sneezes. That's why when you cough or sneeze, you want to completely cover your mouth. And you could do it with your hand. The problem is then you touch things, it gets in trouble. So the best way, in my opinion, just sneeze right into your sleeve there, into your elbow. All right, older adults and people who have severe underlying chronic medical conditions like heart or lung disease or diabetes seem to be at higher risk for developing more serious complications from COVID-19 illness. Please consult with your healthcare provider about additional steps you may be able to take to protect yourself, especially if you're in that high-risk group there. All right, take steps to protect yourself. What can we do? Clean your hands often. I think everyone can do that. Wash your hands often with soap and water for at least 20 seconds, especially after you have been in a public place or after blowing your nose, coughing, or sneezing. If soap and water are not readily available, use a hand sanitizer that contains at least 60% alcohol. Cover all surfaces of your hands and rub them together until they feel dry. Avoid touching your eyes, nose, or mouth with unwashed hands. That's how you get the disease into your body right there. Avoid close contact. Avoid close contact with people who are sick. Put distance between yourself and other people. If COVID-19 is spreading in your community, this is especially important for people who are at high risk of getting very sick. Who is at higher risk? Okay, early information out of China where COVID-19 first started shows that some people are at higher risk of getting very sick from this illness. This includes older adults, people who have serious chronic medical conditions like heart disease, diabetes, and lung disease. If a COVID-19 outbreak happens in your community, it could last for a long time. An outbreak is when a larger number of people suddenly get sick. Depending on how severe the outbreak is, public health officials may recommend community actions to reduce people's risk of being exposed to COVID-19. These actions can slow the spread and reduce the impact of the disease. If you are at a higher risk for serious illness from COVID-19, like we read earlier up there, because of your age or because you have serious long-term health problems, it is extra important for you to take action to reduce your risk of getting sick with the disease. So I think we already knew that. If you are at higher risk of getting sick from COVID-19, you should do what? Stock up on necessary supplies. We already talked about 2 weeks of prescriptions there, minimum. Take everyday precautions to keep space between yourself and others. Okay, you don't want to get others sick. When you go out in public, keep away from others who are sick. Limit close contact and wash your hands often. That shows up quite a bit, doesn't it? Wash your hands often. Avoid crowds as much as possible. Avoid cruise travel and non-essential air travel. During COVID-19 outbreak in your community, stay home as much as possible to further reduce your risk of being exposed. All right. And some of this I know is a repeat, but they repeat a lot of it on the website. That's why there's a lot of repeat there. But I don't think redundancy is a bad thing on many of these situations. Get ready for COVID-19 now. Have supplies on hand. Contact your healthcare provider to ask about obtaining extra necessary medications to have on hand in case there is an outbreak of COVID-19 in your community and you need to stay home for a prolonged period of time. We talked about that before. If you cannot get extra medications, consider using mail order for medications. That's a good idea. Be sure you have over-the-counter medicines and medical supplies, tissues, etc. to treat fever and other symptoms. Most people will be able to recover from COVID-19 at home. So that's good news. We don't want to overflood the hospitals if we don't have to. They only have so much capacity, so if we can recover at home, that's exactly what we want to do. But if you're really serious, don't stop, because it may be your life may depend on getting to the hospital. So that's kind of a judgment call, isn't it? Have enough household items and groceries on hand so that you will be prepared to stay home for a period of time. Take everyday precautions. Avoid close contact with people who are sick. Take everyday preventative actions. Clean your hands often. Wash your hands often with soap and water for at least, how long? 20 seconds. Especially after blowing your nose, coughing, or sneezing, or having been in a public place. If soap and water are not available, use hand sanitizer that contains at least 60% alcohol. We've heard about that before, haven't we? To the extent possible, avoid touching high-touch surfaces in public places. Door handles, stuff like that is where this stuff can accumulate, can't it? Elevator buttons, door handles, handrails, handshaking with people, etc. Use a tissue or your sleeve to cover your hand or finger if you must touch something. So you could put your sleeve over your hand and open the door. That's what it's talking about there. Okay, wash your hands after touching surfaces in public places. Avoid touching your face, nose, eyes, and etc. Clean and disinfect your home. Remove germs. Practice routine cleaning of frequently touched surfaces. For example, tables, doorknobs, lights, switches, handles, desks, toilets, faucets, sinks, and cell phones are some examples. Avoid crowds, especially when in poor ventilated spaces. Your risk of exposure to respiratory viruses like COVID-19 may increase in crowded, closed-in settings with little air circulation if there are people in the crowd who are sick. Avoid all non-essential travel, including plane trips, and especially avoid embarking on cruise ships, it says. If COVID-19 is spreading in your community, take extra measures to put distance between yourselves and other people to further reduce your risk of being exposed to this new virus. Stay home as much as possible. Consider ways of getting food brought to your house through family, social, or commercial networks. Have a plan if you get sick. Consult with your health care provider for more information about monitoring your health for symptoms suggestive of COVID-19. Stay in touch with others by phone or email, so you don't have to have social contact. You may need to ask for help from friends, family, neighbors, community, health workers, etc. if you become sick. So you may need some help, and so be sure and ask for it. If you need help, you don't ask for it, guess what? You're probably not going to get it. So that's important to remember also. Determine who can provide you with care if your caregiver gets sick. So have a backup plan to the plan. All right, practice good personal health habits and plan for home-based actions. There we go. We know we want to stay at home as much as possible. Practice everyday preventative actions now. Remind everyone in your household of the importance of practicing everyday preventative actions that can help prevent the spread of respiratory illness. Avoid close contact with people who are sick. Stay home when you're sick, except to get medical care. Cover coughs and sneezes with a tissue or your sleeve. Clean frequently touched surfaces and objects daily, and we've already went over all this stuff. It's just a review. If surfaces are dirty, they should be cleaned using a detergent and water prior to disinfection. For disinfection, a list of products with the Environmental Protection Agency approved emerging viral pathogen claims maintained by the American Chemistry Council Center for Biomedical Chemistries, CBC, is available at this website, or you can download from the CDC website. Always follow the manufacturer's instructions for all cleaning, disinfection products. They know how to best use the products they created, so pay attention to that. Wash your hands often with soap and water for at least 20 seconds, especially after going to the bathroom, before eating, and after blowing your nose, coughing, or sneezing. If soap and water are not readily available, use a hand sanitizer that contains at least 60% alcohol. Always wash your hands with soap and water if your hands are visibly dirty. Okay, so that was mostly just a review, wasn't it? So there you go. If you have any questions, please contact your local professionals, and they'll be able to help you out. So you're almost finished with this module, but remember to complete the exam as applicable. Remember, for the most update information on COVID-19, go to, and there's a link right there you can take a picture of and type it in your browser. Congratulations, you have completed this module. I hope you have learned something new that will help keep you and your loved ones safe. Remember to always think ahead, be prepared, be safe, and most of all, you've got it, be happy. Have a great day, and goodbye.